3 kinds of fish you should never eat. Soon, you will start facing some serious health issues if you eat one of these 3 fish regularly. Are you shocked? Maybe. Avoiding fatty meats to opt for some healthy fish varieties might be a great choice, but sometimes it might reverse the situation, especially as it relates to the heart. When it comes to managing heart disease, the food choices you make play a crucial role. It is particularly vital to be discerning about the types of fish you include in your diet, as not all are created equal. While many fish are heart-healthy due to their rich content of omega-3 fatty acids, others should ideally be avoided as they may contain high levels of unhealthy fats or contaminants. In this video, we outline 3 types of fish that are best avoided if you're aiming to prevent or control heart disease, to help you make informed and health-conscious decisions. We also tell you what kinds of fish to be eaten as an alternative. Before anything, please note that the information provided in this video is for only educational purposes and should not be considered as medical advice. Please, don't forget to hit that subscribe button and join our community for more insightful content. 1. Tilapia. Farm-raised tilapia, a popular and inexpensive choice of fish, is often a part of diets worldwide. However, its nutritional profile has raised several concerns, especially concerning its omega fatty acid ratio. You might have heard of omega-3 fatty acids and their goodness, but what does that ratio have to do with omega-6? As previously mentioned, farm-raised tilapia tends to have a higher ratio of omega-6 to omega-3 fatty acids. This imbalance is chiefly due to their diet, which is predominantly based on grains and soy, which are high in omega-6 fatty acids. This slanted ratio can contribute to an inflammatory response in the body, which is a known risk factor for heart disease and other chronic illnesses. This is mainly because of the feeds these fishes feed on. The feeding practices of farm-raised fish are a significant contributor to their nutritional profile. The feed often includes cornmeal and soy, ingredients rich in omega-6 fatty acids. These feeds are economical but alter the natural nutrient composition found in wild varieties. Apart from the nutritional aspect, farm-raised fishes sometimes are associated with various environmental concerns, including pollution and the use of antibiotics, which can further impact the fish's overall nutrient profile and potentially affect human health. When compared to fatty fish like salmon, mackerel, and sardines, tilapia falls short in providing a substantial amount of omega-3 fatty acids, which are known to offer protective benefits against heart diseases. These fish varieties are rich in EPA and DHA, types of omega-3s that have a more direct benefit on heart health. Especially for individuals focusing on heart health, choosing fish rich in omega-3 fatty acids like wild-caught salmon, sardines, and mackerel can be a better option. These fish have a more favorable omega-6 to omega-3 ratio and contain other heart-healthy nutrients like selenium and vitamin D. Also, we have to be mindful of how the fish is being cooked to get its benefits to its core. The method of cooking also plays a crucial role in maintaining the health benefits of fish. Grilling, steaming, or baking fish rather than frying can help preserve the beneficial omega-3 fatty acids and avoid additional unhealthy fats. Balancing the intake of animal-based omega-3 sources with plant-based sources like flax seeds, chia seeds, and walnuts can also be a strategy to improve the omega-6 to omega-3 ratio in your diet. For individuals with specific health concerns, it is always recommended to consult with a healthcare provider or a nutritionist for personalized dietary advice. When choosing farm-raised fish, looking for certifications that indicate responsible and sustainable aquaculture practices can also be a step towards choosing healthier options. 2. King mackerel. In the case of king mackerel, the underlying problem is mainly due to its part in biomagnification. You will get to know what biomagnification is in a few seconds. Mercury from industry wastes gets converted into methylmercury in water, which is a neurotoxin. Small aquatic organisms ingest this toxin, and as larger fish eat smaller fish, the mercury accumulates, a process called biomagnification. Being a larger predatory fish, king mackerel ends up with significant concentrations of mercury. Such consumption and entry of mercury into these fishes are highly dangerous. High exposure to mercury, especially methyl mercury, can harm the nervous system. Vulnerable groups, such as pregnant women, nursing mothers, and children, are particularly advised to avoid high mercury fish. In fetuses, infants, and young children, excessive mercury exposure can impact cognitive thinking, memory, attention, language, and motor skills. The U.S. Food and Drug Administration has, in the past, advised pregnant women, nursing mothers, and children to avoid eating fish with high mercury levels, including king mackerel. It's worth checking the latest recommendations as they may be updated based on ongoing research. For those not in vulnerable groups, occasional consumption of king mackerel may not pose significant risks. However, it's wise to consume it in moderation and to be mindful of other dietary sources of mercury. For those looking to gain the benefits of eating fish, such as intake of omega-3 fatty acids, without the high mercury levels, options like wild-caught salmon, sardines, and herring are excellent choices. These fish are lower on the food chain and typically contain less mercury. 3. Escolar. Unfortunately, escolar is sometimes mislabeled and sold as white tuna or butterfish, which can mislead consumers. This misrepresentation not only violates consumer rights, but can also lead to unexpected health issues due to the unique properties of the fish. Escolar contains a high amount of indigestible wax esters, known as gempilotoxin. This substance is not a toxin in the conventional sense, as it doesn't cause poisoning. However, it is an oil that human bodies find difficult to digest. This can lead to gastrointestinal symptoms such as diarrhea, stomach cramps, nausea, and vomiting. In some countries, there are guidelines recommending that if escolar is consumed, it should be in small portions, usually not exceeding a serving size of 170 grams, to minimize adverse effects. Cooking methods like grilling, which allow some of the oil to drain, might also be recommended to reduce the content of indigestible wax esters in the fish. Besides gastrointestinal distress, consuming large quantities of escolar can potentially lead to other health issues. These might include a headache, rapid heartbeat, and even potential interactions with certain medications due to its oil content, which might interfere with the absorption of some drugs. Given the concerns surrounding escolar, some countries have implemented specific regulations regarding its sale and labeling. These measures aim to prevent mislabeling and to ensure consumers are informed about the potential side effects of consuming the fish. So, what could be an alternative choice? To avoid potential issues associated with escolar, consumers may opt for alternative fish varieties. Choices like albacore tuna, which is sometimes referred to as white tuna, but does not contain the indigestible wax esters, can be a safer and more stomach-friendly option. In conclusion, safeguarding your heart health extends to the subtle choices we make at the dining table. While integrating fish into your diet can generally be a heart-healthy choice, being discerning about the types of fish you consume is even more important. Avoiding fish species known for high levels of mercury, unhealthy fats, or other contaminants can be a wise move. Thank you for watching this video, and please consider subscribing to our channel.